here's the harsh reality that millions of retirees don't want to face. Social Security's upcoming cost of living boost for 2026 might actually leave you worse off than before. While recent forecasts indicate that next year's cost of living adjustment, COLA, will climb to approximately 2.7% to 2.8%, a noticeable jump from this year's meager 2.5% bump, the devil lurks in the details that most beneficiaries overlook entirely. But here's where it gets controversial. Is this increase actually helping seniors, or is it just an elaborate shell game? The projected adjustment stems from inflation measurements captured through the Consumer Price Index for urban wage earners and clerical workers, CPIW, calculated using data from July through September. During this critical 3-month window, prices continued their upward march, driving the 2026 adjustment beyond the modest bump retirees received in 2025. For context, if you're among the typical retirees collecting around $2,008 monthly, this 2.7% boost translates to roughly $54 additional each month. Sounds promising on paper, right? Well, hold that thought. Inflation pressures from gasoline, medical services, and housing expenses exceeded expectations during the measurement period. Since COLA calculations depend entirely on that July-September CPIW snapshot, these late summer price spikes pushed projections higher than initially anticipated. The Senior Citizens League, TSCL, along with independent financial analysts, have revised their estimates upward, converging on this higher COLA prediction. While it remains far below the historic 8.7% surge of 2023, it demonstrates that inflationary forces haven't fully retreated from American households. And this is the part most people miss. The official announcement won't arrive until October 15th, 2025, after September's inflation data gets published. That timing creates a planning nightmare for millions who need to budget months in advance. However, prepare yourself for the real gut punch. Medicare Part B premiums are simultaneously projected to skyrocket by approximately $2,150 monthly in 2026. Since these premiums get automatically deducted straight from Social Security payments, nearly 40% of your COLA increase evaporates before it ever reaches your bank account. Think about that mathematical reality. Out of your $54 monthly increase, only around $32 to $33 will actually make it to your pocket. The rest disappears into the healthcare system's ever-expanding appetite for your fixed income. This annual cycle of giving with one hand while taking with the other exposes the fundamental challenges plaguing the 68+ million Americans who depend on Social Security as their primary income source. But here's where it gets really controversial. Does the CPIW measurement actually reflect what seniors experience in their daily lives? Critics argue that this index, designed around urban wage earners and clerical workers, fails to capture the spending patterns of retirees who allocate disproportionate portions of their budgets to healthcare, housing, and food, categories that have been inflating faster than the general CPIW metric. Looking at historical context reveals the volatility retirees must navigate. 2023 delivered an unprecedented 8.7% adjustment, the highest since 1981, followed by 2024's 3.2% increase, then 2025's modest 2.5% bump, leading to 2026's projected 2.7 to 2.8% range. Early projections point toward 2.7%. Though some analysts believe September's inflation data could push the final figure to 2.8%. The Social Security Administration will confirm the definitive 2026 adjustment in mid-October 2025, once all third-quarter inflation statistics are compiled. If the 2.7% projection holds true, the average retired worker's benefit would rise from approximately $2,008 to just over $2,060 monthly. A 2.8% adjustment would add merely $1 or $2 more to that figure. Beyond COLA considerations, 2026 introduces additional structural modifications that demand attention. The full retirement age continues its gradual ascent. reaching 66 years and 10 months for individuals born in 1959. Social Security's taxable wage ceiling will adjust upward, increasing the maximum earnings subject to payroll taxes, while work and earnings thresholds will also receive updates. These modifications impact not only current beneficiaries, but also future retirees, making critical decisions about when to claim their benefits. The gross increase, however, tells only half the story. Retirees should anticipate several offsetting factors that will diminish their actual take-home improvement. Medicare Part B premiums face another sharp increase in 2026, with current projections suggesting a jump to $206.50 monthly, up from this year's $185. Because these premiums automatically deduct from Social Security checks, the COLA boost won't fully reach beneficiaries' pockets. Prescription drug plan expenses, Part D, are also tracking upward, according to preliminary Centers for Medicare/Medicaid Services estimates. Meanwhile, everyday expenses like utilities, groceries, and rent, areas where seniors concentrate their spending, have been rising faster than the CPIW measure used for COLA calculations. This creates a frustrating reality where many retirees feel their COLA increases fail to match real-world cost pressures. So what should retirees actually do with this information? First, calculate your personal impact. If you're receiving $1,500 monthly, a 2.7% COLA adds approximately $40, but subtract likely Medicare increases to determine your net gain. Second, prepare for escalating medical expenses. Premiums and out-of-pocket spending could consume much of your raise. Third, reassess retirement timing strategies. With full retirement age reaching 67 for anyone born in 1960 or later, carefully weigh the trade-offs of claiming benefits early versus waiting. Fourth, stay alert for October's announcements. The official Social Security Administration revelation will lock in 2026's COLA, with Medicare following with final premium figures. Financial advisors recommend that retirees look beyond COLA when developing 2026 budgets. This means incorporating Medicare premiums, prescription drug costs, and other out-of-pocket healthcare expenses into planning. It also suggests considering supplemental income sources or postponing savings withdrawals to maintain long-term financial stability. The COLA mechanism exists to shield retirees from inflation's erosive effects, but it consistently feels inadequate. Healthcare costs continue outpacing general price growth, steadily eating away at household budgets. Even with a higher COLA than last year, many seniors will face increasingly tight spending decisions. The larger picture reveals an even more sobering reality. While Social Security serves as a financial lifeline for more than 71 million Americans, the benefit system confronts mounting financial pressure. Current projections indicate its trust funds could face depletion by the mid-2030s, potentially forcing benefit reductions unless Congress intervenes. For today's retirees, this makes every COLA announcement simultaneously a relief and a stark reminder of larger uncertainties looming ahead. But here's the question that nobody wants to ask. Are we witnessing the slow-motion collapse of America's retirement security system, disguised as annual cost of living adjustments that barely keep pace with reality? What do you think? Does this 2.7 to 2.8% increase actually help retirees? Or is it just political theater designed to make us feel better about a fundamentally broken system? And more importantly, what would you do differently if you were in charge of fixing Social Security for future generations? Share your thoughts, because this affects every single American, whether you're already retired or still decades away from claiming benefits.